As Kenya joined the rest of the world in commemorating World AIDS Day, President Uhuru Kenyatta called for firm action against those impregnating teenage girls. According to the National AIDS Control Council, teenage pregnancies are becoming a major threat in combating HIV and AIDS transmission. And as our Raquel Muigai reports, the HIV prevalence in the country could have reduced to 4.3%. However, there are counties that are still recording increased new infections.
Kenya has made tremendous strides towards alleviating the HIV epidemic. The recent progress data by the Ministry of Health indicating that there has been a 68.5% reduction of new HIV infections between 2013 and 2021.
Our combined efforts as Kenyans has turned our country's story to one of hope rather than despair.
Nairobi leads with 4,586 new infections, Kisumu 2,628, Homa Bay 2,356, Siaya 1,915, Nakuru 1,765, Migori 1,693, Uasin Gishu 1,240, and Mombasa registering 1,009 new infections. Homa Bay, however, remains at the lead in HIV prevalence with 17.2%. Kisumu follows with 15.6%, Siaya 14.7%, and Migori at 10.9%. But there is some good news in counties from the northeastern region, which recorded below 1%. Wajir having the lowest prevalence rate at 0.1%, Garissa 0.2%, Mandera 0.6%, and Marsabit recording 0.7%. And while Kenya boasts of a reduction in prevalence from 6% in 2020 to 4.3% in 2021, among other achievements, there still remains a challenge among the adolescents who account for 11,229 new HIV infections in 2021.
6 in 7 new HIV infections amongst adolescents in sub-Saharan Africa occur amongst adolescent girls. Last year, a joint study by UNICEF and the government of Homa Bay showed how poverty, gender inequality, and limited access to services together drive teenage pregnancies that in turn lead to new HIV cases in mothers and in infants.
Between January and October 2021, 274,510 cases of teenage pregnancies were recorded among girls aged between 10 to 19 years.
Katika vita vya HIV, mtoto akipata mimba akiwa mdogo sana sana haendi clinic kwa sababu ya aibu na nini. Kwa hivyo hata akimzaa yule mtoto na ako yeye mwenyewe na virusi vile, mtoto pia vile vile anapata. Na lakini kama ulivyosikia Mheshimiwa Rais, tunashikana kabisa on a multi-sectoral approach kwa sababu ni kupitia Wizara ya Elimu ndio tutaweza kuwafikia hawa watoto wadogo.
President Uhuru Kenyatta asking for firm action to be taken against those impregnating teen girls.
Hata tukisema ati huyu akishikwa afungwe, afanywe nini, hiyo haitasaidia. Ile itasaidia ni sisi tubadilishe tabia zetu.
While directing the Ministries of Health and National Treasury to ensure that the country is adequately stocked with HIV management and prevention commodities, the President assured that the government will continue doing everything possible to defeat the disease. Raquel Muigai, Citizen TV.
Raquel, thanks so much for that. Now